I'm talking about the possible use of bone-targeted agents in the prevention setting. We've used bone agents for decades, either to treat osteoporosis or to treat advanced cancer. But over recent years, people have tried to look at their role in preventing breast cancer recurrence, and which they are able to do that. And so the next question is, could they also have a role in the prevention strategy? There are two main classes of bone-targeted agents, bisphosphonates and rank ligand inhibitors. I think the potential mechanism for bisphosphonates affecting the development of breast cancer is much more tenuous. And in fact, in my presentation, I will probably conclude that the data suggests that that's not a particularly exciting strategy. We have data from a very large meta-analysis which showed that bisphosphonates stop breast cancer recurrence and stop breast cancer deaths, but had little or no effect on contralateral breast cancer. On the other hand, denosumab is an inhibitor of rank ligand and rank ligand signaling, and that pathway is important in breast development. It's important in breast development and the effects that progesterone has on the breast, and it seems to be particularly relevant to the development of breast cancers in BRCA1 gene carriers. And there was a very nice publication in Nature Medicine just within the last couple of weeks showing this as a really quite exciting potential therapeutic strategy. The early breast cancer clinical trials group was a meta-analysis which I coordinated with the Oxford group, looking primarily at women who've already got breast cancer, and do these drugs prevent recurrence, and do they prevent breast cancer deaths? And in postmenopausal women, they clearly do that. They reduce about 1/3 of recurrences in the bone where they're acting, and about 1/6 of breast cancer deaths. So this is an important development. It's another of these repurposed treatments for breast cancer, for which we don't have a specific license, and all the issues that raises. But certainly in this country, adjuvant bisphosphonates are becoming part of standard management. IBIS III is a study looking at women who are about 5 years out from their original breast cancer diagnosis, and looking to see whether things like bisphosphonates or metformin or continued endocrine treatment can both prevent late recurrence of their breast cancer, but also do they have an effect on new breast primaries. Yeah, it's an interesting meeting for me. It's not my normal area. I mean, I'm a medical oncologist. I'm usually involved more in treating existing cancer patients. I am part of the IBIS program, but so for me this is quite nice, taking me out of my comfort zone. I've heard some interesting science and some interesting new concepts, so it's been very educational for me, and I've enjoyed it. I think each breast unit needs to define its own strategy. That might be run by breast physicians and breast oncologists, or it may be run by breast surgeons with an interest in family history and prevention strategies. I think there are many ways of doing it. I think it's just important that there is a dedicated clinic set up and a research program that patients within each locality can plug into. So, you know, Manchester would be a great example of where that happens. That's something to emulate in our own units. So thinking a bit more about the prevention setting, these recent preclinical data showing the importance of the rank ligand, rank signaling pathway in breast cancer does open this opportunity to use denosumab, which is an antibody. And this would be given on an occasional basis, probably every 6 months, by subcutaneous injection. It's extremely well tolerated, extremely safe, and trials are being developed, which we hope will start within the next 12 months. probably targeting specifically BRCA gene carriers in the first instance, although there may be a rationale in a broader range of breast cancers. So I think this approach is really exciting. It's sort of a knight's move away from the bone effects of these drugs, but potentially a very exciting new development.